If you're thinking about having a tubal ligation or a salpingectomy, I want to invite you to pause. And not to scare you or to tell you not to do it. Definitely not, because that is completely your choice. But because I wish someone had told me to pause and look much deeper and research a little bit more and ask more questions and push the doctors for answers before saying yes to something that would change my life in every way. So, first, let me introduce myself. I am Monica. I have been a registered nurse for almost 20 years. I actually worked labor and delivery. Used to work labor and delivery, and I used to see tubal ligations done all the time. And I also do health coaching. I do medical harm recovery and prevention coaching. So in 2012, I had a bilateral tubal ligation. It was presented to me as simple, safe, and permanent birth control. And like I said, I saw them done all the time. I talked to my doctor, I talked to other women that had them done, and I decided it was the right choice for me. But what came afterwards completely blindsided me. I did not expect to happen what happened. And shortly put, it completely destroyed my health, had me lose trust in my doctor and eventually in the medical system overall, and then even myself. I was questioning my own sanity and my own choices. But let's start with the basics and talk about the procedures. So typically, you have a choice between tubal ligation and a salpingectomy. Tubal ligation is where your fallopian tubes, which connect your ovaries to your uterus, are tied, cut, cauterized, or sealed shut with a device to prevent pregnancy. Salpingectomy is when the entire fallopian tubes are completely removed. And it's often offered now in place of tubal ligation because now they claim that it reduces risk of ovarian cancer because ovarian cancer can start in the fallopian tube. So it sounds great. Now, hysterectomy, of course, is the removal of the uterus and sometimes also your tubes and ovaries. And all three of these procedures are much more complex than what you're led to believe and that what you're told by your OBGYN and your surgeon. These procedures are sold to women as routine, safe, and sometimes even empowering. The doctors might tell you you'll still have your period, you won't need birth control, your hormones won't change at all. It's one and done, no side effects at all. The only thing you have to worry about is to make sure that you don't want any more kids. But what they do not tell you is what can happen when your body reacts badly to it. And what to do if you're one of the tens, if not hundreds of thousands of women who experience serious symptoms after. And what am I talking about when I say these serious symptoms? I am referring to what's known as PTLS, Post-Tubal Ligation Syndrome. Now, Post-Tubal Ligation Syndrome, or these days it would be post-salpingectomy syndrome, I guess, it's not an officially recognized syndrome by the medical institution. But like I said, tens, if not hundreds of thousands of women know it's very, very real. They have reported the same exact symptoms after sterilization procedure, sometimes right away within days like I did, sometimes months, and sometimes even years later. So what are some of the symptoms of PTLS? Heavy or irregular periods or constant periods with no break in between. Pelvic pain, pelvic pressure, low back pain, hot flashes, night sweats, breast tenderness, fatigue, brain fog, mood swings, anxiety, depression, memory issues, suicidal thoughts, decreased libido, early menopause, vaginal dryness, itching, hair thinning, brittle nails, dry skin, severe bloating, pressure in the legs, and the list goes on. I myself have experienced probably 80% of these symptoms. And these are real symptoms that we, real women, feel 24/7 sometimes. They're often dismissed as us getting older, our hormones change because we're older, or some mental health issues. We're just told that we're just stressed. and so on. Or maybe we were told, oh, you stopped birth control, so now these changes. The emotional toll is enormous. The mental anguish is indescribable, because you expect to wake up and just go on your merry way, live your life. But many women, like I did, you end up going to multiple doctors, you get tons of tests done, like I did, CT scans, ultrasounds, and everything always comes back normal. So the doctor comes back to saying, oh, it's all in your head. You are reading too much online, you're reading Dr. Google, you're researching too much, you should stop listening to the women online. So when I went back to my doctor and told him how I feel after the tubal, he completely dismissed me and gaslit me. He told me it's because I regret the tubal and I want more kids. That wasn't true. So then he listened to me and he said, okay, I'll put you on birth control. But I didn't want birth control. The whole reason why I had a tubal was to not be on birth control. So then I was offered a hysterectomy. So I said, why? What's a hysterectomy gonna do? How's that gonna help my symptoms? He shrugged his shoulders and said, I don't know, but we should try it. And I said, well, what if it doesn't work? What else are we gonna try? And then he again said, I don't know. We'll remove your tubes, remove your ovaries. I don't know. At one point, after I've been suffering for a long time and I kept going back to him, just desperate, he offered to sever my uteral sacral nerve, basically to disconnect the sensation and pain signals from my pelvic organs to my brain. And honestly, that was a turning point for me. That was a moment my eyes flew wide open, wide to what's happening in the medical system, to the gaslighting, to them just trying to take more parts out of your body to see what happens, more medical interventions, more changes to your body, more drugs, more referrals. Never once did my doctor acknowledge that the original surgery might have been the cause, even though I was telling him for months and months and months. Now, I was so desperate, of course, I was searching online a lot, and this was in 2012, long time ago. So Facebook groups, I don't think existed yet, and it was a little bit more difficult to connect with women who suffered these consequences. But I was able to find some groups where I heard a couple of women discuss reversals. Now, my surgeon told me this is completely irreversible. You can never go back. The only thing you can do is a hysterectomy. And so I kind of lived in that belief that I can't ever reverse it. But once I saw that some women are getting reversals, I started doing more research. I abandoned all the doctors that didn't believe me, and I started doing my own research. And I did find a reproductive specialist in my area who was doing tubal reversals. He was like the only one left who was doing them. And they, a lot of them do reversals for return of fertility, but he said that about half the women he does reversals for, it's for women like me with PTLS, and he believed everything I was telling him. So this was a huge change, and I was so happy that finally someone heard me, believed me. Needless to say, after my consult, I signed up for the reversal right away. I had my reversal, and it still took a while for me to recover, but within days, my brain fog started to go away, my bloating started to get better, and it took about 9 months for my pelvic pain to go away, but I was having a lot of pelvic pain therapy done, which is amazing, and I recommend that to anyone who has pelvic pain, pelvic floor issues. My nails and hair and skin went back to normal within a couple of months. My intermittent bleeding stopped, and my menstrual bleeding stayed heavy for another couple of years. So I would say I recovered 70-80% maybe with the reversal. I also had ovarian cysts, recurring ovarian cysts for a couple of years, and then that stopped as well. They always resolved on their own. So the other advice, if I may, or recommendation I would give to women who are considering sterilization procedures is to press your doctors on these answers. Ask them, what are the long-term effects on hormones and ovarian blood flow after this procedure? Can this affect my periods and pain levels? And do you recognize PTLS? Have you heard of it? Do you recognize it as a possible complication? If yes, and I develop these symptoms, how will you help me? What is the course of treatment if I happen to be one of the women that develops these symptoms? And one of a very, very important question, which I would love to have asked had I known myself, is how many of your patients have gone on to need a hysterectomy within 1, 2, and 5 years after the tubal or salpingectomy? That will help you get closer to what you need to know. Then also ask, if I end up with these symptoms or change my mind, can this be reversed? Now, these are not extreme questions. They are something that your doctor should be able to answer no problem. Also know that tubal ligation, whether they tell you if it can or cannot be reversed, it can be reversed. I am proof, and many, many other women are proof. Salpingectomy cannot, because they can't put the tubes back in your body. I know some women are having fimbrioplasty that helps them, but it's not a reversal. So we know that women who suffer with PTLS today, they are offered birth control, hysterectomy, uterine ablation, probably antidepressants, because we look depressed, and of course because we're in pain 24/7. Rarely will your doctor give you validation, support, or clear explanation of what happened, and you're left alone to figure it out. And then luckily you find women like me who support other women who are going through this. The other thing that I want to talk about a little bit is that why is this happening? Why does the system not believe us? Why do they gaslight us when we very clearly exist? We are in front of these doctors telling them our story, and it's the same story with every woman. They don't believe us. So if you zoom out and look at the bigger picture and look at the numbers, you'll find out that there's about 600,000 tubal ligations every year in the US, about 100,000 salpingectomies, and growing because it's now becoming the preferred method, and about 500,000 hysterectomies every year. Now that tells you that all these procedures generate billions in revenue. Hospitals, surgeons, device manufacturers, for follow-up surgeries, prescriptions, all the specialists they send you to see, maybe the hormones now you have to be taking. And yet there's almost no informed consent process that acknowledges these risks. No tracking of PTLS symptoms, no support for women once they're harmed. So where are the studies? Why don't we have studies that prove all this? Well, there are studies, but a lot of them are limited, and they almost always magnify the benefits and minimize or omit the risks. Some studies do show clear risk, but they're small, they're not peer-reviewed, and therefore not recognized in the mainstream medical community. So what are some of their limitations of these studies? So usually it's a small sample size, there's short follow-up periods, no pre- and post-procedure hormone testing, exclusion of patient-reported symptoms, failure to account for confounding variables like type of procedure, age, postpartum status, how many times the woman's been pregnant, bias from researchers with vested interest, very important one, and inappropriate or misleading control groups. And this is all by design. I believe this is all by design. So because if they told us the truth, many more women would be choosing not to have these procedures, and their revenue would go way down. And this video is not to scare anyone or instill fear into anyone. It's about the truth. And I shouldn't be the one telling you this truth. It should be your OBGYN. But because they're not telling us, and because I am a living, breathing proof of severe harm, and even all these years later, and even with the reversal, I still suffer side effects of it that are permanent. So I want to be able to help, even if it's a small number of women. All I want is to have women ask more questions and demand answers from the doctors that should be giving them informed consent from the very beginning. Ask the hard questions. If you don't feel comfortable with the procedure, wait. Think a little bit more. Go inside and ask your intuition, what is the right thing for my body? What is the right choice to my body? Am I willing to accept these risks of PTLS if I happen to be one of the women who has ended up with these symptoms? And that brings me to the end of this video. I'm sure I'm going to make more because I could probably be talking about PTLS and the medical system and how they hide the truth for another hour or two. But I wanted to thank you for watching. If you want to find more, you can subscribe or follow me or check out my website. I'm at chironhealthcoach.com. I do offer coaching sessions for people who have been harmed, and PTLS is medical harm. And I also offer prevention coaching. So for PTLS prevention, it would be I offer a coaching session and follow-up phone calls for anyone who wants to talk to me before they make a decision. And I want to make it very clear, I am not a doctor and I am not going to tell you what you should decide, but I will try to help you figure out what choice to make for yourself, what questions to ask your doctor, or what follow-up questions to ask your doctor, and then make an informed decision for yourself. That's really my only goal, is to help people make a decision. I do not provide any consultations. It's just a conversation about helping you decide and share my story if you desire. And again, thank you so much for watching.